Hi. How does it appear when extraterrestrial beings grasp the simplicity of dengue fever management? Myself, Dr. Sudhakar Reddy Tirupati, with more than 30 years of experience in modern medicine, pediatrician, and 14 years of experience in homeopathy, I prefer to be known as holistic practitioner rather than a specialist. My intention is to make things simple for common man. So for that, I need your subscription and encouragement, subscription and sharing. When your bone breaks, you need a bone setter. So in break bone fever, other name for dengue fever, nature's prescription is bone set. The common name of a plant known as Eupatorium furfoliatum, or the common name for a homeopathy medicine known as Eupatorium furfoliatum. The Eupatorium furfoliatum plant looks like this. You can see here opposite leaves fuse around the stem, giving an impression as if broken bones knit back together with a scar, as if the stem broken knit back together with leaves. Let us understand how dengue fever usually presents with. It can present with fever, which may be high, severe headache, usually at the top of the head or back of the head, and back of the eyes. Eyes may be sore. Particularly muscles and joints may become painful, and this is the main characteristic. Very painful bones, aching bones, sore bones, or there can be skin rash, fatigue or extreme weakness, nausea and vomiting. There may be mild bleeding in rare cases. Bleeding can be from the nose, gums, the urine in the stool, or in the vomiting. Suppose you have a doubt about a fever, whether it is dengue or not. If you are confused, no worries. It is safe to take these medicines, what I am going to suggest. The basic medicine, as I already told you, is the Eupatorium furfoliatum. It can be usually combined with another medicine known as Rustox. The medicine dosage is usually like this. Dose is made by dissolving 2 drops of dilution or 6 pellets, and potency is 200 Ch dissolved in 250 ml of water. From day 1, start giving 5 ml every 2 hours, and usually within 6 hours after starting the treatment, you can see the recovery. Suppose if you don't see the recovery or improvement in 24 to 48 hours, you are advised to seek a medical advice. Alternatively, this medicine can be taken in 30 potency dose also. 30 potency, 6 pellets, morning and evening in adults, and 2 to 3 pellets can be given for a child or even a newborn. That's it. This is the treatment. In our 90% of common dengue fever cases, this treatment alone is sufficient, eliminating the need for unnecessary antibiotics and unnecessary antiviral drugs. Well, you already know a treatment that surpasses what 99% of people typically receive. Maybe this looks like this when a safe and effective cure for dengue fever is finally found. With this treatment, with this approach, you can definitely say no to antibiotics. One curious thing I want to share with you is any fever, particularly any fever, in 90% of the cases, it is caused by virus. But ironically, in 90% of the cases, you get a prescription of antibiotics. The question is why? So same things applies here. No need for antibiotics. There is no role for them to play here. And the role of antiviral medicines, I doubt the efficacy of antiviral medicines because I have seen they are ineffective in case of chikungunya even for 6 months also. They are ineffective in case of herpes zoster. I have seen many cases being ineffective in COVID also. And finally, no steroids, that is a danger zone, do not enter. Finally, you can say yes to blood tests to check the platelets. If there are petechiae, if we see small red dots on the skin, we call petechiae, or there are some bleeding signs, particularly if there is bleeding from the nose or from the gums, or in the urine or in the stool, or if there is a blood in the vomitings, definitely go for a blood test immediately. Or if there is a skin rash or extreme weakness or fatigue, or when required SOS. Prevent dehydration, maintain fluid levels and maintain blood pressure. Suppose you have a doubt that somebody in your family is affected with dengue fever. You can definitely take a preventive medicine or a prophylaxis. The common medicine is definitely Euphotorium furfoliatum. This can be combined with either arsenic album or rustox depending on the symptoms. The dose is 30 Ch potency, 6 pills morning and evening 2 times a day for 3 days. For a child, 2 to 3 pills 2 times a day. The common mosquito which spreads this virus, dengue virus, is Aedes aegypti. This feeds mainly in dusk and dawn, indoors in shady areas, or when the weather is cloudy. But they can bite and spread infection all year long and at any time of the day. Share this information and educate the ignorant. By following this schedule, you can help prevent many unnecessary deaths. Following this regime, you can reduce the need for frequent hospital visits, unnecessary hospitalizations and blood transfusion. This schedule can greatly shorten the duration of illness, and these guidelines can lead to substantial individual cost savings, financial savings. Lastly, it provides a safe and effective cure for dengue fever, free from any side effects, suitable for all ages from newborns to elderly people. My intention is to, I am repeating, make things simple for the common man. For that, I need encouragement from you. Please, if you only subscribe and share, I can do all these things. I want to share one more important thing here. This I am talking about my upcoming video. Do you know that at least 95 lakhs of people or 1 crore people are affected by paralysis in India every year? And you can prevent or cure at least 50% of paralysis caused by stroke or bleeding in the brain, what we call intracranial bleeding, with 4 simple medicines if they are provided, if they are given within first 24 hours. Like that, there are many interesting articles you can go through. Thank you for watching this video. Thank you for your time. We will meet soon. Thank you very much.